Today I'm answering your questions on some of my most popular videos. Let's go. Let's talk tummy tuck. Part one of this series, I'm going to discuss with you who is a good candidate for a tummy tuck. There are two types of fat: external subcutaneous fat, which I can treat with surgery. Here are the six-pack muscles. Internal visceral fat that surrounds your organs, I can do nothing for you for that. So you can see abdominal surgery can be really complicating, and we want to give you the best results. So let's look at some of your questions and see what I can teach you today. All right, Rhonda asks, I had twins and really want a tummy tuck, but I have a side tattoo, hip to ribs. What would a tummy tuck do to it? So Ron, it depends. If your tattoo is low on your belly, that's normally the skin that we remove in a tummy tuck, and most commonly, we take the whole tattoo off. In your case, it sounds like the tattoo is on your side and most likely will not be involved in the skin resection at all. Amanda asks, what about diastasis recti? First, what is diastasis recti? Everyone has two six-pack muscles in the middle of their abdomen, and the connection between the two is called the linea alba, which is a fancy term for the connection between the two muscles. Diastasis recti is when that linea alba, or the connection, stretches and you get a wide gap between the two six-pack muscles. This can happen in three different ways. One, morbid obesity, where they carry a lot of internal fat, can stretch those muscles apart. A second situation where that can happen is in pregnancy. Similarly, they have a lot of intra-abdominal pressure, which can literally tear those muscles apart. The third way this can happen is some people are just congenitally born with a separation between those two muscles. Whenever we do a tummy tuck, it is normal for us to resuture those muscles back together. All of us surgeons do that with an abdominoplasty procedure. The next question is from Colleen, and she asks, what's the difference between an abdominoplasty and a penniculectomy? Well, Colleen, a penniculectomy is when we remove the skin below the belly button, and that's all we do. We do nothing else. Now, a tummy tuck procedure is more of a contouring procedure, which involves not only removing extra skin, but we also have to make an incision around the belly button because we're going to relocate it once we remove all the extra skin. So why would we do a penniculectomy versus a tummy tuck? Sometimes patients get really bad rashes because they have a bunch of skin on the lower abdomen below the belly button, and that can become infected, and it's a really tough problem. In that case, we would perform a penniculectomy because we remove the abdominal, quote, pannus. That's what we call the extra skin, and that's all we do. So the main difference between an abdominoplasty and a penniculectomy is that a penniculectomy has no involvement of relocating the belly button or fixing diastasis recti, where we do all of those things in a tummy tuck procedure. All right, our next great question came from Butterfly7. I like this one a lot, and she asks, okay, I work out and I eat healthy. At which point do you recommend a tummy tuck versus lipo? I would like a doctor that challenges my options. Well, Butterfly7, a tummy tuck and lipo are two very different procedures. So how you know which one is right for you would be during your consultation with your surgeon. So your surgeon is going to look at the quality of your skin and how much extra subcutaneous fatty tissue you have, and match that with what your goals are and guide you to which procedure might be better for you. So a patient who's a candidate for liposuction would be someone who doesn't have a lot of extra skin. They have pretty tight, good quality skin, and they just want some of the fat suctioned out so that they can shrink wrap their skin around their muscles, and that's all they need. Patients who need a tummy tuck or qualify for a tummy tuck have a lot of extra skin that sags over the belly button and maybe hangs over the lower pubic area, and in those cases, liposuction would only create more loose skin. So if you liposuction someone who has a lot of extra skin, think of it like deflating a balloon, but you still have all the extra skin there. So in that case, your surgeon might push you more towards a tummy tuck because it's going to give you the better result. All right, the next question is from Vicky Cruz, and she asks, can someone with diabetes have a tummy tuck? So for those of you who don't know a lot about diabetes, one of the problems with diabetes is that the blood vessels become diseased, and we need good blood supply to heal tissue. Now, just because you have diabetes and it's controlled doesn't mean that you can't have surgery. So in these situations, we take them on a case-by-case basis. We look at your overall health. We look at how well your diabetes is controlled. And if you're a good, safe candidate, we proceed. All right, the next great question is from Mama Boss 17. And her question is, so if a person has diastasis recti, are they not a good candidate for a tummy tuck? Well, Mama Boss 17, the only way to fix diastasis recti is through a tummy tuck. So this is why tummy tucks are not weight specific, they're symptom specific. So irrespective of your body type, the only way that you can re-suture those muscles back together is to formally have a tummy tuck. Katie Boone asks a good question. Do you see a lot of adhesion issues from prior surgeries? And it sounds like from her question, she's had an appendectomy and a C-section, and she feels like things are tearing, and she wants to know, is that dangerous for a tummy tuck? So one thing you should know is that an appendectomy is intra-abdominal. It's behind the six-pack muscles, and we go nowhere near that for a tummy tuck procedure. Now, your C-section scar is very different. When we perform a tummy tuck, we usually make the incision below your old C-section scar, and we actually cut through that scar tissue and we remove it with the specimen. So in essence, your appendectomy has nothing to do with the tummy tuck procedure, and your C-section scar is of no consequence to obtaining a good result. MST asks a question that I hear a lot from some of my patients who are a little bit older, and that is, I'm 56, is a tummy tuck safe for me? So here's the deal, guys. It has nothing to do with your age, and it has everything to do with your health status. When you come to see me for a consultation, I will send you for preoperative clearance to your primary care doctor, and together we risk stratify you. We look at your labs, we look at your EKG to get an assessment of your heart, we look at whether you have other comorbidities like diabetes, and we make a decision whether you're high risk, moderate risk, or low risk. So once we've risk stratified you into high, moderate, or low risk, your other doctors and I will figure out and determine whether you are a safe candidate to have surgery. Jules asks, can a tummy tuck be done at the same time as a C-section, or do they have to be separated? I've always wondered since my first pregnancy. Jules, I am so glad that you asked me this question. I probably get 10 DMs a month with this exact same question. The bottom line is, it is a horrible idea to do those procedures at the same time, and I'm going to tell you why. When you have a C-section, they enter the abdominal cavity, which creates a lot of swelling and things are pushing out on the abdominal wall. Well, the exact purpose of a tummy tuck is to tighten up the abdominal wall, and when you have the opposing force of swelling, it can compromise my ability to tighten you maximally and give you the best result. So while it sounds sexy and convenient, it's not the best thing to do. All right, the last question is from Morticia Adams, and she asked, so would someone with a beer gut have a lot of visceral fat as opposed to subcutaneous fat? So when you gain weight, it's not specific where it's going to go. Everyone is different. So you could get it visceral, you could get it subcutaneous, or you could get it in both places. Can you target visceral fat versus subcutaneous fat when you're losing weight? And the answer is no. When you lose weight, you can lose visceral fat as well as subcutaneous fat. It just comes off at its own pace, but at the end of the day, you eventually will lose both. All right, my friends, that's a very complicated topic. Hey, listen, if you have other questions I didn't answer, make sure you put it in the comments below. For now, Dr. Ricky, out.